Sensitivity and specificity. These two concepts are most commonly tested in the board exams. And these two tests are used for diagnostic testings, accuracy and validation. Imagine an individual has a disease condition and suspecting the disease, and now the test shows no disease. That can be very confusing. Or a person who has no disease but the test shows person has a disease, so that can cause severe anxiety and also lead to the various other testings. So that's the reason why these two tests are widely used for validating the accuracy of diagnostic test. So let's start off with a patient case scenario, that is a 45-year-old woman with fatigue and pale, suspected of iron deficiency anemia. So there are two diagnostic tests for anemia are available. Test A, that is sensitivity is 95% and specificity is 70%. And the test B, sensitivity is 70%, specificity is 95%. So for this one, here is a question. The question is, which test should be used for initial screening? Or second question is, which test should be used for confirmation of this anemia? So first, to understand this, to solve this question, first we have to understand the concept of sensitivity and specificity, which is to validate those diagnostic tests. These two concepts, sensitivity and specificity, are widely used. So what exactly sensitivity is? Sensitivity is diagnosing truly a patient who has a disease. That means the proportion of disease correctly identify individual as disease. That means someone who has a disease, the tests show that person has a disease. That is a sensitivity. And specificity means proportion of non-disease correctly identify individual as a non-disease. Means if someone has no disease and the test should show that has no disease, that obviously. So here both of them can be used one specific terminology. Sensitivity is a true positive rate of the diagnostic test. Means how much true that test is. Like how can be that test can be reliable to consider that if that is a test is considered as true positive test. Whereas the specificity expressed as a true negative test means if it is there is no disease, how true that it is no disease. That means it tells you the true negative rate. So sensitivity tells you the true positive rate means if that person has a disease, for surely that truly that person has a disease. Whereas specificity tells you there is no disease because person has no disease. Well, how can you make sure that is those are accurate? So to understand that further, here is let's start with the example of two groups of patients, a disease group patient and also a group of individual that is non-disease. Well, first we have a test A. A test A, according to the previous question, sensitivity was 95% and specificity for the test A was 70%. So what exactly this sensitivity 95% means? That means, let's say you have a group of patients who are anemic and there are a group of patients who are non-anemic. So there are 100 patients that are anemic, means they have anemia or suspected to have anemia. And now this test shows sensitivity 95%. That means there are 95% are true positive. That means that 95% of those patients have the anemia according to the test. from the 100 patient. However, there are 5 of them, it shows negative. That means even though they have anemia, but test shows negative. That means it is a false negative. So next here is about specificity. Specificity is there are 100 individuals have no anemia or non-anemic. Test shows there are 70 of them have no anemia, that means true negative, whereas 30 of them shows that it is a false positive. That means it shows patient has anemia, even though they are having no anemia. It's like imagine specificity is like a false alarm. There are 30 false alarm here, whereas sensitivity is trying to capture as many as positive. Like sensitivity is like casting a net to maximum capture the candidates who have anemia. So that is what test for sensitivity. So from this test A, one thing can be used here for is because this test A has very high sensitivity, that is 95%. So what exactly that means? How do you interpret that in terms of the test validity? So this can be considered as like test A can be used for best for screening because this captures 95% of those tests positive. That means only 5 of them are being missed here. That means even though 5 of them has anemia, but test shows that non-anemic. So the only 5 is missed, whereas it is captured the 95 of them. So therefore, test A can be appropriate or suitable for doing for screening test. Like initially, if person has a suspected to have a disease, then this is a go-to test because this has a higher sensitivity. Higher sensitivity test is used for screening. However, the next test, test B, as per the question, test B has sensitivity 70%, specificity 95%. So here we have again the group of anemic group and there are non-anemic individuals. There are 100 of those anemic groups, whereas this out of those 100, when sensitivity is 70, that means 70 of them are captured as a positive anemic. That is a true positive. However, 30 of them have been missed here. Therefore, even though they have anemia, but test shows non-anemic. So therefore, it is considered as false negative. So that's the reason this less sensitivity is an indicator of there are major, a big number of questions. The individual's test has been missed. That means it is a false negative test. Next here for this test B, there are 100 group of individuals have no anemia, and now test shows according to specificity true negative. Means there are test shows there is no anemia. That is considered as a true negative test. However, this also has a 5 test or missed here. That means 5 of them, even though they have no anemia, but test shows that they have a anemia, which is therefore we consider as a false positive. All right, so what is this test used for? Like this test has a higher specificity. Higher specificity, that means you have a less false positive. Therefore, if even someone has false positive, that means it can be considered as that person has the anemia, even though that group of patient has a non-anemic. So therefore, when you have a high specificity, it is used for confirmation of diagnostic test. So specificity higher, good for confirmation, whereas higher sensitivity good for initial screening of the test. All right, so let's summarize this in more details. So here the summary: screening, high sensitivity is the best metrics. That means there is a few cases are missed even though they have disease. So therefore screening, casting a wide net captures more. That means it having a higher sensitivity can be more good for screening. Whereas confirmation is high specificity is preferred because you avoid more false positives. There is a most popular mnemonic for this one is SYN out. SYN for sensitive, for which is a N for negative, means helps to rule out the disease. So for example, in previous test A, there was 95% was sensitive. That means 5 of them are false negative. So that means those 5 can be used as a rule out. That means the negative test can be used for ruling out that that person has no disease. So therefore, this is this is ruling out for screening those disease patients. Whereas the spin specific test, when it is a positive, that means it confirms that the person has the disease. So therefore, it is a rule in for the disease. So these two concepts or two mnemonics are very powerful, widely used for understanding these two concepts. Because the most board questions, they can ask you in various different ways to test your concept on these specificity and sensitivity. So therefore, understanding those concepts can be summarized from sensitivity, negative for rule out the disease, whereas specificity and positive for ruling in for confirmation of the disease. So therefore, these two are very powerful points. So finally, to take a summary of those applying concept, test A is highly sensitive, means it detects all true positives. So therefore, it is used for best for screening, and you don't want to miss any potential cases. Whereas test B, highly specific, meaning it correctly rules out those without disease. So for that reason, best for confirmation because it helps to avoid false positives. Well, let's take away key points is sensitive test for screening, S and out, and specific test for spin. Whereas here, further stay tuned for more videos. In the upcoming videos, I'll be demonstrating about using this true positive, true negative, false negatives for how do you interpret positive predictive value and negative predictive value. However, these two values are primarily depends on the prevalence, the number of total cases. That plays a very important role for those positive and negative predictive values. Until then, stay tuned. Thank you for watching. Subscribe Pharmacy Prep channel. See you again.